Hi everyone, my name is Danny, and today I want to make a special video. I'm going to be talking about healthcare and some of the things that I have learned from it, but especially I want to dedicate this video to all of the healthcare providers and take my time um, reflecting on an experience that I had for a year. It's not been the first one with healthcare, soon to become healthcare professionals. They're medical students. And this has taught me a lot. I have been mentoring medical students for about 4 to 5 years now, um, excluding the year of the pandemic and another year that I took off, I believe. But other than that, it was a great thing. And I'm going to be sipping on some ginger beer. So, there are some things that I take away from this experience and that have been great, not so great, and unfortunately, I'm not able to express all of these things in like 7 or 8 meetings because that's what we have to work with 7 or 8 meetings, and they are pre scheduled. And that's one of the drawbacks of this program, that we don't get the flexibility that we need. Number two, I wish that this was expanded, although it's very limited right now in the things that it can do or that we can do, not only as mentors but mentees, is that we need to expand this to other states and hopefully to other countries. I think there's a great need for doctors, for upcoming doctors, to change their mindset, to know that we're not just a number, that we have a name, that although with our various disabilities, or even one, we matter. And I don't think that a lot of doctors do that. And so today was my last meeting, and I was reflecting back on this. And I said, because they were asking me what things needed to be changed within the healthcare industry. And I said that one of those things was that uh, we are working like robots. And even they are working like robots, as if they were robots, because what do they have? They have a bunch of questions, and it's all ask, answer, ask, answer. But there's no real interaction. There's no real human interaction, if that makes any sense. And so, what this does, it doesn't provide that trust with your healthcare provider. Doesn't matter if that's a healthcare practitioner when it comes to your general healthcare practitioner, or if that's a physical therapist or a speech therapist or whomever it is. You don't get that um, sense of, oh, he's or she's here to help me. I can relax with her or with him. I don't have to feel judged, or I don't have to be felt as if I'm being scrutinized all the time. And I think this is one of the big problems, that we like rushing through things, even though we may not be healthcare professionals. This can happen uh, anywhere. We rush things and we don't give people the amount of time that they deserve to express themselves as freely as they can. And as I said, when they were asking me this, I understand that um, healthcare practitioners have a lot to deal with. They have a lot of patients to talk to, and they have to do this, and that. But if you can have 2 minutes with a person where you're not rushed, where you can take notes, and then in your own spare time, um, get some things together. If that person has asked you for some information, I don't know, but there has to be a way to make that relationship with your patient closer than it is. I know emergency rooms can be, again, a lot of times chaotic, but in the middle of that chaos, you can find something to take away, something to help your patients. In clinics, they're a bit more relaxed, so I believe you can have a more like a 5 minute interaction, and your primary care physician or provider has to do this, has to make sure that you guys are spending quality time together where your concerns are being heard. Um, and one of the other things about this program is that they don't tailor it specifically to you. I think that this type of program, community mentor program, needs a bit more work when it comes to, again, it's the mentor that has to work with the students. There needs to be more leeway on more round discussion type of questions, um, where we can be free to discuss more things. Um, and when you make these questionnaires, make them thinking on the person who they're directed to. For example, I've talked to you about my cerebral palsy. I've talked to you about my migraines. I've talked to you about my blindness. I've talked to you about the difficulties that I have with a lot of things. And so these are the type of questions that are asked, or maybe not asked. They just ask you general questions. What are your disabilities? And this and that. And so, with that said, all they do is they gather up some students with multiple, in their multiple disciplines, nutrition, physical therapist, what else? Occupational therapy. There might be three or four others. But anyway, the thing is that they make these questions so broad, or they make these categories so broad, and there needs to be more of a personalized experience. So I can come up with one, and I told the students this. Let's say I was preparing for the meeting on nutrition, and that's the topic that's on hand. Fine. We are going to focus on how has nutrition affected you as a person with CP. Oh, fine. This is easy. It's affected me this way. It's affected me that way. Some people with CP have this. So there's a lot of things. But when you make it so broad to where you say things like, so what does your nutrition look like? What do you eat? And I don't know. It misses the point. You have to relate it more to the person. So I don't feel that the experience overall, and this is not student based. What I'm saying is, students don't come up with the questions. Students don't come up with the topics that are going to be discussed. These are predetermined by whomever the advisors or coordinators of these programs are. So it would be nice if these coordinators took the time to talk to your mentors and or to write a survey, and from that, try to engage people and try to come up with actual topics that relate to that person's disability or disabilities. That would be a thing to do. But again, there wasn't enough time. Sorry, there wasn't enough time to do that. And one of the constraints also that students have, not only this time around, but in the past, is that it's done every specific day, and it's only from this hour to this hour. So you have a window that you can choose from, but they don't want you to be there for too long. And even today, there was a student missing, which again is bad because that student misses out on one of the whatever happened. When a student is not able to be present because of rotations or whatnot, you also have certain things that need to be addressed and that are not, because if you are on the phone or Zoom, remember that these type of technologies nowadays block off some of the background noise, so as the person that you're talking to can hear you better, but it doesn't take into consideration that, let's say, there might be somebody a bit further from the microphone. So when they speak, let's say on a Zoom call, they're not, the other person who's listening to that Zoom call is not going to understand that person because they block that sound because it thinks it's background noise. I'm not sure if I'm making any sense, right? So let's say you're talking to your significant other, and there's a person talking in the background behind you. More than likely, Zoom or any other technology is going to block out that person as much as possible, so you and your significant other can hear each other better, or you can hear your significant other, better in this case, or that needs to change. And this is why whenever I know that I'm going to be in a Zoom call meeting, and I know that I'm going to be far away from where the microphone is at or whatnot, I speak louder than usual. So the person who is on the other side listening to me, either on the internet or whatnot, is able to understand the words that I'm saying as much as possible, so that person doesn't miss out. But again, you can't do that when it comes to schools because you don't know if there are other rooms that are being occupied or whatnot. So it's a little bit hard when students are not present and we have to do these things via Zoom or another platform. Um, so that's one of the challenges. And again, I would like if we would be able to, again, just make our own schedule, or let's say if somebody misses a meeting, or if I, for whatever reason, health reasons in this case, would not allow me to attend a meeting, if we can make that up another day. I still think that these type of programs, this is the only one of its kind where I live. I believe that it would be nice if next semester or 2 semesters, I don't know, because it's every year, if we could make these small changes to where mentors could have a little bit more leeway or control, if we could be free to explore where it doesn't feel so stuffy. Um, and the reason I'm making this video is so you guys know how things work. Um, Eventually, I believe that what needs to happen, as I said before, is that these kind of programs need to be expanded all over the state, all over the United States, and internationally, where first of all, it becomes an elective, try it out and see if it works. And then if it seems to cause quite a buzz, then yeah, make it a requirement for not only, in my case, I believe these students were second or third year in med school. I believe it should be from the first day you step into med school. It should be one of those things that you should do to get familiarized with people with disabilities. In fact, I would go further than that. What I would do, I believe a lot in integration, and this is where education comes in. As you know, I've spoken about special ed schools um, and regular schools. In my case, I would prefer that there would be more integrated schools rather than special ed only or regular ed only. And have these integrative schools start as young as 6 years old or younger, even, because this creates an atmosphere of acceptance, which is what we all need, right? We all need to find one another. We all need to make sure that we understand one another. So by the time that we're 14, 15, 16, we've already had that exposure to people with disabilities. We would already know what to do and how to act when we get our first job, waitressing or serving other people, if you will. We will get our first experience of what it's like to help a person with a disability if we are volunteering for, I don't know, something, whatever that may be, you know, and there happens to come along a person who has a disability. We would already have an idea of how to treat that person. But because there is no school such as that one, or very little, um, the very few, I should say, we don't have that opportunity. And the more parents and even people with disabilities advocate for, oh, I want to be in a school where only disabled people go to. No, you're only limiting yourself. You're only segregating yourself. You're part of the problem, right? So we need to start this from a young age. I believe a lot in having these schools be united. It has to start at a young age. There has to be more than one healthcare professional within the school to bring help. If you're new to this or if you've never dealt with this, make sure that the transition is as painless, as easy as possible. And this also has to do with what I've talked about on this channel as well, which is gun violence. You know, a lot of the crimes that are perpetrated by people who have mental illness is because they've been alone, because they've been rejected. It's because they've been thrown away. And what difference would these type of things, what type of impact this would have had if they would have gone to schools, where they would have been accepted and, things like that. So again, going back to the mentoring part, if we had an exposure as a young age and we got to this point there, to where, oh, I want to be a healthcare professional, I want to go to med school, fine. By that age, you would have encountered a lot of people with disabilities. Um, you would be more keen to knowing the experiences of people with disabilities. There would be a more empathic society, a more caring society. Things would be so much easier. But anyway, so I'm going to stop this video right now. I just wanted to give you like a glimpse of what this program was like for me. I enjoyed hanging out with the students, getting to know them, ask questions, as well as having them ask me questions. But I would have liked, as I repeat myself again, if there were more free flow of ideas where we didn't have to be restricted, if you will, in a way. And that's what I hope, that all these invisible barriers, if you will, would stop, and we would have a more productive conversation. And yes, they have checked out my YouTube channel today. So hopefully, as they begin or continue their journey toward becoming medical students, they would subscribe to this channel and to similar channels that also provide you with information on how to treat a person with a disability, and find out that a person with a disability cares about much more than just games for the blind or tech for the blind. We, as a blind community, in this case, care about a lot of things. I've talked about, sports. I've talked about politics, religion, societal issues, and I'll keep talking about a lot of these things, even more, including healthcare. Because again, I don't think that 8 sessions within a year are enough. There has to be much more. And as I said to them, as I finish my last meeting with them, was that we need to find something in common with one another. We need to find something that unites us, that brings us together. And I think for this group, as well as for the other groups that I've been privileged to mentor, it's been that we've connected for one reason or another. Either we've lived in the same city, or we speak the same language. Something I try to find something that connects me to one person within the group, if not with more than one person within that specific group. So I hope I can keep on doing that, and I can't wait for what next year has in store. If you have liked this video, if you are considering joining the healthcare industry, or if you are in the healthcare industry either for a year or 10 or whatever amount of years you've been within the healthcare industry, what do you think? How do you think we as a society can improve our communication skills with people who have disabilities? And this goes even further, like within the therapist, psychology, or counselor. What can you do? What do you think you can do to make the experience better, the interaction better? So yeah, I think that this should be a thing that should be implemented If you want to become a counselor, if you want to become a psychologist, if you want to be involved in whatever capacity within the healthcare industry, it's important. It's going to be beneficial, not only for you, but for the person that's talking to you. Um, it's brought me a lot of joy. It's brought me a lot of peace, and certainly I know that I'm being a small part on shaping the future of our healthcare industry. And I hope to be doing that for a long time to come, just as I hope to be um, um, somebody who shapes the future by creating this type of content on YouTube, where, in spite of the shortcomings that I may have as a YouTuber, that people will still continue to watch these videos, that we can improve together. And I will make a similar video for YouTube and some of the things that it needs to work on to make things better for us as a community with my specific disability. And yeah, so thank you very much. Please consider subscribing, sharing this video, and commenting, suggesting any more topics that you would like, asking questions. It's the most important thing. There's no bad question. It's just the way that you phrase it, the way you ask it, that matters. So thank you very much. I appreciate your time, and I will catch you next time. Bye.